English, okay, I'm speaking in English. Well, this is me. Where is here? I want to talk about my experience in the last 15 years for more than 1,700 tattoo treated. Okay, my conflict of interest, but I don't going to mention any trademark. First, start with that. It's really important start continue study about the power of the light because last year the Nobel Prize in Physics was for these three guys. They discovered the attosecond. Look, the quantity of zeros in the number is a lot of. It's more than pico is 1 billion in Spanish. In English speaking is it's a trillion. This is a quadrillion. I don't know how I say it, for 6 times more fastest than the picosecond laser. I really believe in the phrase, we all have the right to repent, light and form us. Our marriage don't need to stay forever. Tattoos no longer have to live that forever too. That's why we need to pay attention to the patient and give the possibility to change the quality of life. We are able to say that a quarter of people around the world have at least one tattoo. This is true. Here, in this session, there's a quarter of people with at least one tattoo. And we are able to say, too, that a quarter of them are going to regret it. And we look for a solution. It means that a lot of potential patients don't lose that all potential patients. I am part of these freaks because I don't have any tattoo. I don't know in the future. Think about that. The difference between millisecond or microsecond devices, majority of the laser work in this quantity or unit of time, against nanosecond or picosecond that obtain a photomechanical effect, that obtain a photothermal effect against the photomechanical effect. This is really important to avoid a scar, for example. Like this, you can see here, I tested with the IPL, I tested with the Q-switch, I tested with IPL, look the difference of the endpoint. This going to leave a scar, this only is frost for no less than a week. And even Nano and Pico are really good devices for tattoo removal. The best is Pico because you still have some kind of thermal effect when you use a nano effect. When you use a Pico, it's close to a perfect picosecond photomechanical effect. That is less problem, less scar, and more particular disruption. And why? Because it's important that because our macrophages have the opportunity to eat any kind of unit less than 60 microns of size. Less than that. Bigger than that, it's impossible to go through the lymphatic vessel. That's why we need to disrupt them and make less particular to make it more easier the work of the macrophage to take out all this, the tone, all the ink. That's why if you obtain more disruption, you can help our macrophages to eating well. This is my experience since 15 years ago. In total of 10,000, yes, more than 10,000 of treatments. Some facts, tricks, and tips that I learned during this all long trip. The theory proof. This is really important. Look at that. We said that the photoacoustic reaction is we obtain the disruption, go with the macrophage to the lymphatic node, and in some cases we can throw it away from our body. But here is the proof. This is a difficult tattoo. And look at this shadow around the tattoo at the 4th session and increase at the 10th session. What is this? It's the ink inside the macrophages, inside the lymph node, going away. And this is the theory proof. The second, menu la carte. I love to say that to my patients because I give the possibility to erase the part of the tattoo that they hated and leave the part of the tattoo that they love it. Like these two little birds, and I take out the phrase because the phrase was part of his previous couple. Or in this case, he loved this star, this one, but he don't like the comet. When I erase the comet. Or this one, he only want to obtain this in Spanish constelación. I don't know in English. Constellation, okay, thank you so much. And erase all around it. Or too many flowers, I leave only one flower, I obtain this result, and my patient will love it. Prolonged PIH. All people to handle with tattoo removal, all need to handle with that. Prolonged PIH is a matter of fact. And you want to obtain a great before and after picture and great result, is you need to have a lot of patience, because from here, during a complete year, we have this situation. We don't do nothing, only indicate cream of tyrosine inhibitor or plasminin inhibitor. We can talk about in the discussion, in the Q&A, but no more than that. Don't still use the pico, because you can hurt it, you can obtain a leukoderma. Stop the treatment when you obtain this situation, okay? Only a matter of time. Again, before and after, the intermediate situation. Again, before and after, Charlie, go away from the life of my patient. I need to help her. In the middle, she's still happy with me, but use a lot of these pulseras to cover that. And after that, only one. Hemosiderosis. Act exactly like a tattoo. Look that. If you put iron by injection, in some cases you obtain this kind of pigmented, and you need to use only Q-switch laser. A nanosecond or picosecond. Don't use another kind of laser to obtain this kind of result. A scar is a change of texture. I still have that, like in this case. But look that. I mentioned the time. The time is magic. Before, after 3 years, and after 3 years, she came for another thing. She came for filler over the lips, and I said, let me look your back. Let me show me your back. And this is the result, doing nothing. Light color is a tricky colors because you need a lot of wavelength to be sure you can reach to everyone. Like in this funny mosquito tattoo, I use 3 wavelengths, and this is my result. It's not perfect, but it's that I need the result that I can reach with this difficult tattoo. But in some cases, in my previous nano period, I asked to the patient to return, because I'll be able to erase this green, yellow, and red tricky colors. Or in this case, you can see the sequel, the sequence of the treatment, and I leave this leukoderma over the close to the navel. Another difficult tattoo, my result after, you can see here, the 4 sessions. And cosmetic tattoo, always say to the patient that when you start the treatment, you are to change the tone of the color, because it's made by iron in an oxidized way. When you apply the laser, you obtain the desoxidized way of the same iron. That's why change gray or dark to red or brown. But it's only a matter to change the wavelength and have a successful treatment. Let's just in this case, the patient decide to, no, doctor, stop now right now. I love this red tone. Well, I was able to give a red tone over the eyebrow. In reactions, electric reactions always by the red tone, because it involves sulfuride, and look the situation in the skin of my patient. But when you erase all, I give the possibility to retattoo it again. Or in this case, he still loves river plate. I found a river plate too, but we erase the heart, and the patient can leave the name. White. This is my great advice. Trying to avoid it. Try to avoid this treatment, because when you apply the laser, change to gray, and it's really difficult to have a solution. It's many sessions, not less than 10 sessions. I prefer to avoid the treatment. It's both made by titanium, and always change the tone. When I have some problems, like leukoderma, just in this case, or just in this other case, but nowadays I apply a lot of sessions of CO2 to allow me to induce to the hyperpigmentation, and by this I can cover this area of leukoderma. Some other case, close to the finish of my presentation, who are the ones to rewrite and look for a solution. I made a survey over my patient, 757 patients complete a survey. This gives me the possibility to publish that in Medical Laser. It's a more important laser journal in Asia. I am a reviewer of this journal, and I found that far away from, I think before, majority are women with an average of 30 years, with a high level of education. Most of them are professional, black, and the reason why is because they are they disagree with the treatment, no professional, no change of couple. It's only a matter of they regretted in the way it was made. In some cases, it's difficult to find the tattoo. Lucky for us, lucky for the one to treat this kind of patient. Like this one, I don't know what this means in Japanese. Oh, this one, or this neck. And in some cases, I obtain the testimony of my patients because I'm really happy with the result. And it's difficult to find where I treated. I need to put a mark, like in this case, or like this another case, because I say it again, it's a matter of time. After a complete year, the texture of the skin changed, and it's really difficult to find the place I treated. And finally, in some cases, as I mentioned, I can change significantly the quality of life of my patients, like this one. Yes, he suffered violence and domination from her couple. Joel, he ran away. He's close to a slave of this man, and he put the names Joel in many parts of the body. But I was able to give the possibility to, again, get the work because she's afraid of any kind of mirror in which one she finds Joel. I use Moisturizing with collagen, chloramphenicol, and Vaseline. Of course, in cases I indicate corticosteroid, sunscreen, and the clue for me is during many months, I indicate the inhibitors of melanization, as I said, tranexamic acid, kojic acid, and hydroquinone. Best color to remove are black, yellow, and red. Worst color to remove, green and light blue. White and cosmetic tattoo are tricky. Try to avoid any kind of white. Amateur tattoo, the easy one, many colors, slow result, but I can be able to remove it. The more recent, the slower the removal, the closer the tattoo to the lymph node, the faster to remove it. In conclusion, in my experience, when I change to nano to picosecond, I can cut the regular session to 20 to 40%, that is true. And study the population where you live, because 1 in 4 inhabitants, 25% of all people around you have a laser tattoo, and in any part, in any time of their life, they want to revert it and look for you for a solution. Thanks so much.